everybody. I'm going to get started here in a few minutes. Just going to give everybody about a minute or two to get settled in and signed on. Once again, I've spoken to you guys maybe now 6 or 7 times. My name is Dr. Tolentino. I'm from EliteHealth here in Miami Beach. I am a hormone specialist here in Miami, and the next topic of discussion we're going to go through is on your thyroid. Previously, we've discussed the sex hormones. We've talked about estrogen, how important that is, progesterone, testosterone, and I think of equal importance, if not more importance, if you could even say there was such a thing as more important. I still think the thyroid and of course your adrenal glands are two topics that really do need to be discussed in more detail. Today I'm going to focus more on what exactly the thyroid hormone is, where it comes from, the types of things that can cause low thyroid symptoms, different ways to basically treat it. And next week I'm going to go into more detail about the types of supplements that you can take to help enhance the functioning of your thyroid. And you should also be taking the same types of supplements to also enhance the functioning of your adrenal glands. I've mentioned to you guys previously that all of the hormones are almost like that symphony where you do want everything in balance in order for you to feel your best and look your best. Luckily, for a lot of people, this may not be an issue, but there's plenty more people out there that have a lot of issues with their hormones that they don't even realize are hormonal. And of course they may go see doctors and they may correlate it with other reasons or tell them that it could be due to something else, when really it's actually your hormones that are the problem, or the hormone imbalance actually that's causing everything. So if you have any questions, make sure that you send me an email. My email is jt@elitehealth.com. JT as in Jacqueline, Tolentino, T as in Tom, @elitehealth.com. So that's JT@elitehealth. And feel free to check out the website. If you want to see me as a patient, you can always come to the office. You can call in to make an appointment, schedule to see me. I do have a lot of patients that specifically come to see me for their thyroid. It's something that I had noticed over time, over practicing a hormone management over the past couple years, that out of all of the hormones that I get as far as questions and patients that have the most symptoms for, it's the thyroid. So this is definitely a good topic and a good thing for you all to learn about. So the thyroid hormone is actually produced in your thyroid gland. It comes from your hypothalamus to your pituitary. There's signals in your brain, and those signals, they signal down to your actual thyroid gland to help you produce more of what you need. And the thyroid is important for many different things. It's actually responsible for your heart rate. It's responsible for your temperature, your balanced temperature throughout your body. It's also responsible for regulating your metabolism. Those things are very important for the functioning of your body. It also is important for the functioning of your brain and your brain function. So those major things when it comes to regulating your heart rate, your temperature throughout your body, also your metabolism, very, very important. And a lot of patients have symptoms that you can even physically see that relate to them having low thyroid levels in their body. Now, when the brain signals your actual thyroid gland, sometimes the actual problem is not just in the signaling between your brain to your gland, and sometimes it can even be in the actual gland itself that causes the problem, or it could even be in your peripheral tissues. So the actual stimulating hormones, they come from your brain and they signal your actual thyroid gland, and it's also in your peripheral tissues that the actual thyroid hormone is actually being used by all of the cells in your body. So yes, your gland produces thyroid hormone, but it's also produced in the cells in your body. So it's very important for you to understand that it may not be the signaling problem, it may actually be the conversion to the active thyroid hormone that's the problem. So sometimes when doctors are checking your levels, they're only checking certain markers, but they really should pay attention to all the different markers that are important to really take a look at someone's thyroid function. The thyroid, in order for it to function its best, it actually needs the help of other hormones. I've mentioned how important the other hormones are, whether it's the sex hormones or even your adrenal glands. For thyroid, the thyroid works hand in hand with your adrenal gland hormones, and mainly, specifically, the cortisol that's produced there. So if you have high amounts of stress, then of course that's going to affect your cortisol hormone, and that in turn causes you to have abnormal functioning of your thyroid hormone. So it's almost like a chain reaction. When one thing is affected, it does kind of snowball and affect the other hormones. And that's why I say it's very important to have all of your levels checked and not just one or two. So in summary, as I mentioned before, it's produced in your gland, but the more active form is, we call it the free T3, and that's what your body is actually utilizing. In order for your body to convert what it makes in your gland to that active form, that happens in your cells throughout your whole body, and it does also happen in your thyroid gland. It does get converted also from the liver and other tissues as well. So the free T3 is the active form that your body is actually using. The T4 levels that are often checked by the laboratories when the doctors are getting the levels, it's not as important as the free T3 is in relation to what your symptoms are and how your body is actually utilizing it. So that's very important. Most of the time in the office, I do get a majority of patients, probably 9 out of 10, with hypothyroid symptoms, where their thyroid is sluggish or not working as well. Aging does this to us. Some patients have antibodies and they start to develop antibodies inside the gland that keeps their gland from functioning well. And sometimes it's really that peripheral conversion from the inactive form of the thyroid to the active form that is the most important part that sometimes doctors seem to miss out, or they may not pay attention to. So there's different ways that your body is actually making the thyroid hormone and actually utilizing it. So it's very important for you to understand that the conversion of the thyroid hormone to the active form that your body is using is sometimes overlooked, and that may be where the problem is. Thyroid medication-wise, there's only a few major medications that people are using to treat it, but there's also ways to enhance it naturally. There's supplements that you can take to help enhance the functioning of your thyroid gland and, of course, your adrenal glands, because I mentioned that those two work hand in hand. So also from the diet, from the foods that you're eating, there's different types of foods that you can eat to help make your thyroid function better. Exercise is equally important. So is sleep. You're making sure that you're getting good sleep. Very, very important. The types of symptoms that I see most common in the office when it comes to the thyroid, most commonly weight gain. I also see a lot of patients with excessive amounts of fatigue throughout the day, not just fatigue at certain times, but just feeling sluggish and tired throughout the entire day. I also have a lot of patients that have a lot of dry hair, dry skin, very brittle nails, even hair loss or hair thinning, hair shedding much more than usual. Those are the major symptoms that I see for thyroid or hypothyroidism. There's tons of others. I would probably say there's maybe 50 symptoms that you can even think of, that I can think of, that go along with thyroid. However, those are the most common symptoms that I see for a low thyroid. Also, if you have temperature regulation problems, I mentioned that thyroid was important for regulating your body temperature. A lot of patients do suffer from like the cold hands or cold feet. Not even just the hands and feet. Sometimes they're the only ones in the room that feel really cold, like their whole body feels cold, and everybody else doesn't seem to have that problem. So I do see a lot of patients that have temperature regulation issues, mainly the coldness that they have in the hands and the feet, or sometimes just whole body issues with coldness. Other symptoms of thyroid not working too well. Symptoms of depression. I did mention it does affect the brain function, symptoms of depression. Memory issues, like even just little memory issues, brain fog type things, where they're just, very, very minor things that they don't even really think that are probably could attribute from your thyroid. I also have patients that have a lot of water retention, so a lot of the bloating issues, or their body seems to be retaining a lot of water. There are also problems with the weight gain from that perspective as well. And of course, as I mentioned before, the coldness, the anxiety, and the dry skin. Thinning of the hair, it's not even just hair from on your head, it can even be your eyebrows, thinning of your eyebrows, thinning of your eyelashes, those types of things. They've even proven that patients with low thyroid functioning have problems with fertility. So I do get a lot of women in here that have problems with their thyroid. They don't realize they may have a sluggish thyroid or maybe they're having problems in their body converting from the inactive form to the active form. And so they do have a lot of symptoms of hypothyroid or subclinical hypothyroid that go along and paint that picture, but it does affect fertility. So again, it's important to realize all of your hormones need to be balanced in order for your body to be functioning the way that it's supposed to, for you to have as minimal symptoms as possible. So those are the main symptoms that I see for patients that are low thyroid. Now, the problem is that most doctors, they're really not paying attention to all of the hormones, and so they may not realize the effect that one hormone may have on another hormone. I've always tried to stress that to you guys. It's really important for you to understand that the hormones are all affected by each other. So, if I can take a simple example of, the stress hormone, cortisol, which we'll talk about entirely in another discussion. Cortisol, if it's raised too high or if the level remains high too long, and your body is not able to recover back to its baseline, that affects your thyroid gland. Your thyroid gland affects not just the production here in your gland, but also the production in the other tissues of your body. So in order for your body to be using thyroid, you need to have free T3 or active thyroid levels that are quite elevated for you to feel your best. Doctors should be checking out not just one or two markers, not just the TSH level that's coming from the brain. That's not the only marker for the thyroid that they should be checking for. So it's important that you should bring up to your doctor that you want to check all of the different markers for your thyroid. Also, you should have the other hormones checked as well at the same time that you're doing that, so you can see if there's any sort of imbalance or issues like that. You can come see me here in the office or find a doctor that's very well versed in hormones and understands how important the balance is. They can help educate you on all of these things that I'm talking about and tell you how important they are, but they can also help you fine-tune the details of where the imbalances are occurring and how you can help them. That is probably the basics on hypothyroid. Now, hyperthyroid patients, I don't get them quite as often. I do get them, but it's more common that I see a lot of the hypothyroid. Again, there's different types too. It may be a problem in the gland, a problem converting in the tissues, also a problem with the functioning of the signal from the brain to the actual thyroid gland. So there's many different ways to go about looking at it. Now, the symptom list is a lot longer, but like I mentioned, those were the most common symptoms of low thyroid functioning. And yes, there's a number of supplements out there. The most common things that I see as far as supplement-wise that are great for your thyroid are things that are going to help it to function naturally better. Some people, they're not able to get their levels optimal enough to the point where they feel their best. And so in cases like that, then they may discuss other options with their doctors. So some patients, do take medication to help some of their symptoms and also help with their levels to help balance things out. And that can be discussed in more detail with your doctor. So make sure you mention to them that you want to have your thyroid checked. So in summary, the most common things or the most important things that we're looking at for the thyroid is to check to see not just where your levels are of one marker, but multiple different markers. We're also looking for any antibodies where your gland may not be working quite as effectively. The different types of things that can cause your thyroid to not work as well are problems with other hormones, mainly the adrenal glands. You'll see a lot of problems there. So if there's increased stress or problems with their cortisol for other reasons, then that will affect your thyroid. And I think that it's important for you to touch base with your doctors, at least on a yearly basis when it comes to your hormones, to check and see if there's problems with balance or issues that you may think that need to be addressed. The most common symptoms, again, that I see with patients with sluggish thyroids or low thyroid functioning would include the weight gain, the fatigue, the cold hands and cold feet. I do get a lot of patients with that. Also, I would say the hair thinning, also the increased shedding or the hair loss, also the dryness of the skin. So those are the most common symptoms of the hypothyroidism that I see. If you want to discuss this more, feel free to come see me in the office, or if you have some general questions, you can always email me, jt@elitehealth.com. Make sure you check out our website as well, elitehealth.com. And I will discuss in my next Periscope some ways that you can improve the functioning naturally through the different types of supplements and how they actually help your gland or even help the peripheral tissues convert to the active form of thyroid. We'll talk about the supplements. We'll also talk about the different types of foods that you should be eating to help your thyroid gland function better as well. So I will see you next Wednesday, 5 o'clock, so that we can go through these things. And if you have any direct questions, make sure that you email jt@elitehealth.com. I will see you next week.